Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey.
Hi, my name is Mali Sharafat, and I'm filling in for Jeannie Pete. For today, I like to say Jeannie is vacationing in some kind of paradise island, but she's actually working. But don't worry, Jeannie has sent her assistant Kelly to make sure that I don't mess up. Kelly, say hello to everybody.
Hi, everyone. I'm here just to make sure everything's going to go okay. And Miss Mally, I doubt you'll mess up. I'll be learning from you.
Thank you for joining us for a better living. I am actually thrilled to be here, and I'm going to try to do a better job than Jeannie Pete does. First of all, let me start telling my thanks to Jeannie Pete that last 3 years they have conducted this show. This foundation, which is a better living, is brought by the Homestead Hope Foundation and sponsored by Homestead Hospice, is a result of situations that we have seen every day from our seniors' life when it comes to, make the tough decisions, how uninformed they are. Our passion comes in from the situation that we witnessed in the last 6 or 7 years. That's why we have today's guest. Today, I'd like to welcome Dr. Rogan, who has agreed to join us and talk about health and well-being of as we age. Dr. Rogan visits patients in the home, whether in private residence or wherever they call home. Assisted living. Dr. Rogan, nursing homes, group homes, personal care home. He actually goes there and visit good amount of time with them and find out what's wrong with them and treats them. He's a primary care physician, and he has a passion for senior, care. Dr. Rogan, welcome to our show.
Good morning. Thank you. Really appreciate it. Thank you, Miss Mally. Thank you, Kelly. And thanks to Jeannie Pete, who's out there working for a company to make things better for everybody out there and also for the geriatric population. This morning, Miss Mally and Kelly, we're going to talk about some home visits, talk about home care physicians. We're going to talk a little bit about the life expectancy of seniors, as well as the mortality rate associated with some seniors and the most common cause of death in all ages of group of people, but also the most common cause of death in some of the senior care people as well.
Dr. Rogan, just talk about your education, your background. I know you're a physician, and then Please tell me what you do.
I'm a board-certified family practitioner. I raised in Tennessee, completed my undergraduate education and my medical education at the university and a medical school in Tennessee in the Nashville area, and completed my training in family practice in a combined program with Emory and Morehouse here in Atlanta. And subsequently, after completing those residency training, I had a strong interest in doing geriatric care and started doing a lot of nursing home work. That led to working in several different hospice companies, as well as doing some assisted living, home visits, and pretty much have stayed in the geriatric field as my current interest of care.
And Dr. Rogan, do I need to have a special circumstances in order to call you to come and see my parents at home?
To be qualified, so the question basically is just see if you have qualified for being a home patient. Yes, you do. There has to be a medical need. There also has to be medical necessity. There also has to be an issue where the patient is taxing to the family, to themselves and to the family, and trying to get out of the home to the primary care physician's office to be seen for their primary care issue or acute illness.
Who pays for your services?
The patient's insurance company, the private insurance companies, also our state and federal Medicare programs also pay for it as well.
Is there any co-payment they have to pay?
No, there's no co-payment involved. Unless some private insurance, like a commercial insurance, may require some who have a different supplemental income from a Medicare program. That may require some, but usually Medicare itself takes care of the patient's visit.
I want to clarify that one more time. What kind of seniors or patients is qualified for home care physician services? Be very specific. Can they drive? Can they active? Do they have to be bed bound? Do they have to, can they be active and, be qualified for your services?
They need to be not necessarily bed bound, but also taxing to get out of home. If they're driving and they're going out every day and going to the Piccadilly's for lunch and then also maybe going to do mall walking, they're not qualified.
Even the mall? Macy's? No. They can't go to Macy's?
Well, they can go to Macy's in a wheelchair maybe, but no. But they're not qualified to, if they're just going to say, I'm a mall walker, they're not qualified to have a home visit. Those patients are still qualified to the point where they can still go see their primary care physician in the office. But it has to be a taxing situation to the family, to the patient, and also the patient has a chronic condition that causes that patient to have to be qualified as a homebound patient.
But they can at least move around their home. They can independently live in their home. That they can as long as they don't drive, they cannot drive, they can qualify.
That's correct.
Good. What kind of services do you have? Do you do the same thing as they go to the doctor's office?
Exactly. I bring the patient's primary care office to their home. Everything that you will see, you'll get your vital signs, you'll get your weight. If you need blood work done, if you need x-rays, we'll contract with x-ray companies, lab companies to provide services. If you need physical therapy, we may consult with a home health agency to come in to do therapy, occupational, speech, or physical. So it's just exactly the same thing you would have if you would just walk into a patient's doctor's office right here in downtown Atlanta.
Great. And then in your experience, tell me some of the special, unique circumstances that you have encountered.
A lot of things that we usually encounter, a lot of chronic diseases, a lot of patients who are immobile, especially from stroke disease, heart disease, neurological diseases, patients who develop immobility problems because of cancers and also certain problems with orthopedic problems. They can't walk, they have a generalized weakness. But it's a whole plethora of different medical problems that we will see. We'll even see patients who have problems with blood pressure who really need to see the doctor on a more frequent visit, or even their uncontrolled diabetes where we need to get education involved right in the patient's home, just as if we would do in the doctor's office.
What happens if they need a specialist?
They can still see a specialist. We still arrange for that. And if they need transportation, we can talk with the family about trying to get them into the office, or if we can try for private transportation, try to get them to that specialist as well.
Can you tell me about a statistic and tell me why the home services are becoming more popular and more needed? And actually, we have less doctors who does that, but we have more more seniors who needs that. Tell me about the statistic that you have.
Right now, we have a large population of people who are living longer. They're actually, the geriatric population is expanding. By the year 2013, they're expected that over the age of 65, there's going to be about 70 million patients that are going to be over the age of 65. Right now, we're looking at somewhere between 30 and 40 million people over the age of 65 at the current time who are not living in a nursing home. And really and truly, only about 10% of those patients actually live in a nursing home. But the main thing is that patients are requiring more care and more home care and more situations where other facilities are getting filled up, so they need to stay at home for their private care.
Dr. Rogan, when I see the independent living and I see some of residents, they have scooters and then they are actually transporting themselves with the scooters. Is that qualifies for a home, patient, the scooters that qualifies them for a, physician visit?
It could. Some scooters can, sometimes they could be a little bit excessive, but usually if Medicare will pay for it, but you can still have the opportunity to move about your house freely on a scooter. And sometimes people use them to actually go up the street to the convenience store to buy something.
Yeah, I've seen a lot of them.
Yeah. So sometimes that has become excessive, and that has also become a problem in some insurance companies too, because it has become an excessive issue.
Well, you just said is that general life expectancy in over 65, generally, people, they live in longer.
Right.
And then is it in your experience, and then healthy living, it seems like, they can drive, but they are healthy and they need more home services. What other services beside you arrange for them to have at home, like a home health, And do you all refer to different, I know you are a medical director for a hospice and then, and a home health agency. Do you, arrange for all of those things?
We do. Actually, when I go into the patient's home, I am their primary care doctor. I will arrange whatever services are necessary for that patient to have at that given moment. If I need to consult with a specialist, I will. If I need to consult with home health, I will. And even if it becomes an end of life issue, I also will think about talking to family, consider hospice care as well. But usually, whatever has to be done at that patient's home will be done, even in concert with other disciplines like home health, hospice, nutrition, physical therapy, occupational therapy, whatever the modalities may be to make that patient home and his medical care of paramount importance.
Am I understanding that you can arrange a total care at home?
That's correct.
Well,
the
that's a
whole-
very good thing. Everybody's working and then traveling time. And then I know when I take my father to a doctor, it takes a whole day
Yeah.
just to, go over there, wait, and bring him in. And then
Right.
it's really becoming very difficult. And thank you for sharing this, with us. Do you have any other thing that you would like to share with us today?
Well, just the thing you're just saying about your father, and I understand the ramifications of having someone to take off a whole day to go spend 10 or 15 minutes with a doctor in a doctor's office, because that becomes taxing. That's how they become qualified for home care. It's very difficult to have a patient pushed in a stretcher in an office office lobby, than have that patient still at home, still getting that care by the primary care physician within themselves. And the physician usually spends a quality amount of time than they would if they were in the primary care doctor's office. You might get 15 minutes if you're lucky in the doctor's office, where you may get an hour and 15 minutes with me at home.
Well, Dr. Rogan, it sounds like how do you afford to do this? Because it takes time for you to drive the place to place and spend an hour, time with each patient. And then I know you have came to my house and see my father. You were there about an hour and a half. It sounds like it's a lot of burden on you. You make money out of this?
Oh, absolutely. Insurance companies are based upon time, and they're based upon a time basis, all graduated up on how much time you may spend with the patient on 15 to 30-minute increments, up to 2 hours of time that you can spend with the patient.
Dr. Rogan, everybody talking about Obamacare. Is that going to affect, my home physician visit?
No, it actually may make it better. I like Obamacare. I really want care for everyone.
Don't say that out loud. The majority of physicians, they don't like it.
I do. And I appreciate that. And I'm for the nation, and I think that Obama did what he did and said he was going to do for people. It may cost some people some money, but that's part of business. So it will balance out, I think, on a positive scale for Obamacare in the future.
Because the other day somebody was telling me that Obamacare is going to come and then it's going to eliminate all the home services. And last night, actually somebody told me is that hospice, they have to discharge patients because Obamacare is not going to pay for it. Well, I told them, no, I work in a hospice, and that is not the case. But you're telling me that Obamacare will allow more home visits. And then, do you visit patients monthly or as needed? How do you do this?
Both. We see patients acutely for any problems, but usually we try to see every patient every month. And speaking about the situation of Obamacare and the thing that you talk about hospice, I haven't read that or heard that at all at that time, but I could see it actually being more stringent on certain criteria for hospice home health and in the future, and making things a little bit more tighter. But I'm not sure that it's going to qualify patients not to be on Obamacare or have to leave hospice because of Obamacare. I haven't heard that. That's going to be interesting for me to find out.
Oh, no. I researched that. It's not such a thing, I was just, and everybody,
I'm glad to hear
it's such
that.
an unknown thing, and everybody has, figuring out, what anybody else saying.
Yeah.
And
Well,
then,
I'm pro-hospice, so I'm glad to hear that, Ms. Malley.
no, there is no cuts, there is no discharges, Well, actually, what they trying to do is that they're trying to tighten the criteria.
Right.
Hospice is an end of life, service, and it should be for end of life, and it's a support system that then family in crisis they really need.
Right.
And then Dr. Rogan, one of the reasons that this Homestead Hope Foundation came about, because as a medical director for a hospice and home health, when you visit them, the people or adult children that they are busy to raise their children, they are busy to run their businesses, doing their work. It's very hard for them to know about benefits, what they are entitled for. Mm-hmm. Yes, everybody knows about Medicare and Medicaid, and then everybody expects they have an understanding, but the detail of it, you only hit when the crisis come in. That's the whole purpose of this show, is to come and then give the information and then to knowledge to our listeners, and then they hear it. They probably don't need it right now, but then know about it when the time comes in. They don't go to panic. They know, oh, I heard about this.
Right.
Let me call and ask more specific questions,
Right.
rather than more general questions.
Right.
And that is how this whole foundation has come about. And Dr. Rogan, when you are medical director for the hospice and also home health, and then is that allowable to be primary care and then also the hospice physician at the same time?
Yes, ma'am, you sure can. Even the criteria as well as the regulations in hospice state that you can also, the hospice medical director, still perform as your primary care physician in hospice.
Great.
But also there's like two facets. Home health is basically for a short period of time, where hospice is also for a short period of time, but sometimes it's usually a lot longer than home health. The patient will be on home health.
And Dr. Rogan, and I know my father, and loves his doctor, and then he always insists to go see her. Can you be involved in a patient's, care? If they have another primary care doctor, can both of you, can one physician see him at home, and then, and every 3 months, maybe, we can take him to see, his most liked, physician that he has come to trust for the last 60, 70 years,
I'm glad you mentioned that. That's something I want to mention, because we do work hand in hand with the patient's primary care physician. The primary care physician who can't come to the home loves us out here going out seeing their patients and report back to them as a physician deficient communication. And that's great. We can still communicate. If the patient wants to not go back to their primary care physician, we usually try to send reports, or even sometimes we're at the bedside, is go ahead and get a physician a call and say, what is your recommendation? Do you want to increase this lisinopril? Do you want to increase this patient's metformin? Do you want to even decrease the medication? And they can actually tell me what they really want to know about that patient, because it may be he or she could get something from the chart to help me with the patient's care right there at the bedside. It's kind of like getting a quick ER visit right at the bedside, like home health in a way. But I'll see that patient again probably in 30 days.
In your experience, home visit, do they reduce the, hospitalization, more frequent visit to, emergency room?
Oh, absolutely. Because usually most emergency room visits with patients over age of 65 can be alleviated by checking the patient's medication, preventing falls, preventing iatrogenic side effects from certain medications, and usually that's what the case. But hospitalization rates are usually tremendously decreased by a patient having home visits.
I know, Dr. Rogan, we are running out of time. Talk about medication, because I know for a fact, for me and then for my mom and dad, getting medication has been very difficult, because sometimes we go to CVS, they don't deliver. And then do you have any pharmacies that, that you can put an order through and they actually deliver to, residents, home, people's home?
There are a few, and there's a few here that I've been associated with here in the downtown area that does a very, very good delivery service for some medication. Patients really need medication delivered to their home. But most of the commercial places do not deliver. But if you find like a home-based pharmacy or something of that nature, they will possibly deliver. But that's usually the way the patient get the medication, or the family just performs as the courier to get the medications for them.
One last question, because I know is a very important thing for us, in my household. If my father goes to a hospital, do you also go to hospital, visit them? Do you have privileges for the hospitals to go visit our, their patients,
I do have hospital privileges. Usually, most doctors who are so busy nowadays, they use hospitalists a lot of times instead of using their time to try to go into the hospital, because most of their primary care office time is really spent seeing primary care patients. But seeing the patient in the hospital, along with the admitting physician in the hospital, is something that we also do as well.
But then, you get reimbursed for that too?
If I actually write a note and visit that patient in the hospital, I can, if I consult. But if the primary care physician is seeing that patient, he's the one who's billing for that patient.
Well, thank you very much, Dr. Rogan, for, being here. I know I had the pleasure of working with you for the last 6 years. It has been total joy, and you've been always ready to help, be available, at least for my father and my mom. And sometimes we even, overuse you for my daughter too, and gosh, you are a life-saving, and what a program. If 6 years ago somebody would have asked me if there is such a thing exists, I said, of course not. No doctor can afford to come to your house. I mean, these people, they have overheads, they have to pay, they have to drive an hour to come get to your house. But you know what, it's such a wonderful thing that there is a program like that exists. And thank you for coming.
Thank you.
And I appreciate it. And then Any word of a wisdom?
Good health, good living. The life expectancy of things are changing, and there are certain causes of certain death that we are doing much better. Prevention is a cure nowadays in healthy living.
Thank you very much. We take for a short break, and then we will be tuned in soon. Thank you for listening.
Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey.
Welcome back to Better Living. This is Mali Sharafat filling in for Jeannie Pete. But don't worry, I don't mess up that bad. Jeannie has sent her assistant to watch, make sure that we don't mess up today. Kelly, could you say hello?
Hello, everyone.
And then we are here with a fabulous guest, very entertaining. Today, I'd like to welcome Dr. Rogan. Dr. Rogan visits patients, whether in private residence or wherever they call home. He actually goes there and visits good amount of time with them and find out what's wrong with them and treats them. He's a primary care physician, and he has a passion for senior care. Dr. Rogan, welcome to our show.
Good morning. Thank you, Miss Malley.
Hi, Dr. Rogan.
Hi, Kelly. Good morning again.
Hi. I just have some questions from you.
Absolutely.
From a point of view, I don't know if most people know, I went to medical school myself, and I'm in my late 20s, and it's interesting listening to you. I'm 20. Miss Malley's saying I'm old.
Yeah, you probably are.
Yeah, old. I'm in my early 20s.
Well, I'm 26.
But I just wanted to get your input because as a student nowadays, we're taught get the patients in, get the patients out. You got to watch your costs. You got to watch this. You got to watch that. But it's really interesting listening to you say that now you can actually retransition that idea of medicine that I knew I grew up in, and as we saw on TV with the Leave It to Beaver and the family physician coming. It's just interesting to hear that nowadays it seems like that's coming back. Why do you think that shift? Is it just like a full circle?
Well, history does repeat itself. You know, I grew up in the age of Marcus Welby, Trapper John M.D., you know, those type of shows that I grew up on. That's how I learned medicine. ER years ago. I know you're too young to remember that.
No, I watched ER every single day on every Thursdays.
And then,
I loved it.
Yeah.
And what was the one that was Denzel was on? Was what?
Denzel.
It was a show. There was a Saint Elsewhere.
Saint Elsewhere.
That was a great shows. And now we learn from Grey's Anatomy. Things are different. Things have changed, but the training is still there. And cost is always an issue with everything that we do. In medicine, years ago, most doctors practiced primary care, did surgery, there were specialists. But nowadays, everybody has to know a little bit about what everybody is doing, but we still have our specialists, we still have our primary care doctors. But we now have more physician extenders, more nurse practitioners, more physician assistants helping us to provide the care, to spend more time with the patient. And find out that if you did a patient satisfaction survey, the thing that patient would most often say is that the doctor didn't spend enough time with me. And getting a nurse practitioner who can actually take a patient from you while you're running around doing the acute things, and they can spend an hour with you, will actually improve the patient survey tremendously. So basically, healthcare, seeing the patients more, we're seeing more chronic diseases. Of course, we're seeing more cancer. I grew up in the year when we didn't hear much about HIV. Now we hear, so much about HIV. You got to know more about HIV. There's so much cancer out here.
Dr. Rogan, do you send nurse practitioners for follow-up visits? Do you have nurse practitioners working with you?
I do, even in the nursing home and also out in the field seeing home patients as well.
But they basically just do a routine visit, do they? Just follow-up visits?
They can do follow-up visits. They can do the initial visit as well. But usually we would like to try to alternate every other month with a physician as well as a nurse practitioner seeing the patient on the visit to the patient's home or in any location.
I guess it's just interesting to hear that just like any other type of business, the medical field just accommodates whatever trends are going on in that certain time period. Like you were mentioning, of course, in the early 80s, when AIDS and HIV was very, very prominent, people were in the medical field scrambling to figure out what that is. And it seems like now you're saying with chronic illness and the baby boomer generation getting up there, that the medical field needs to also accommodate and pay attention to the new trends and what's going on.
You know, just like, yeah, exactly. You know, like nowadays, you know, you wouldn't think of a person over the age of 55 or 60 being HIV positive. But I have patients right now in the nursing home who are HIV positive. But from, you know, because of the advent of some of these erectile dysfunction medications, it's caused them to act a little bit crazy out here. And they, you know, it's caused them to want to experience a few things.
Relive the youth. Yeah,
exactly. And then also you have the growing population, which has become a big problem with HIV, is the young population. We have children between the ages of 16 and 25 are becoming a high prevalence of HIV as well, too.
Wow.
So, and then you have that mid-range of a population of people between the ages of 35 and 50 who also having this problem. So we have to really just be looking at the whole thing of everybody. Just doing primary care, family care, you have to just do the whole spectrum. You have to do pediatrics, you have to do primary care, you have to do family care, you do OBGYN, and you end up doing the geriatrics as well.
It's just very interesting I think for the listeners, especially when we talk about this stuff. I know for people from all age groups can learn about different topics that are out there.
Right.
And like Miss Malley was talking about earlier, even if you just hear a little slice of what's going on, that'll trigger you to go do some more research, figure out what it is you need out there, especially with the benefits, as we were talking about earlier. Yeah. And it's just, I think, an eye-awakening experience for everybody involved.
Right.
Young, old, doctors, caregivers, nurses.
Right. Exactly. There's a U.S. Task Force of Preventive Medicine out there that been around for many, many years. It's a federally funded program. Our Surgeon Generals who've been before us have always looked at those programs as very highly needed in education of the patients, because those programs actually show prevention and things of what you need to do from day to day, from year to year, and also from month to month of what you do at a particular age group. And the leading cause of certain deaths in most all individuals in the United States is tobacco abuse today, and also poor nutrition and inactivity. So a lot of people who are pushing preventive medicine are looking at nutrition and tobacco and inactivity as the main ways of doing prevention. We can look at every show on television, and there's always going to be something about some nutrition or something about some cholesterol, something about some type of tobacco, or especially when the sporting game's on, to try to help prevent certain or make awareness of what these leading causes of death are, and we're not doing a very good job about it, especially in our television industry.
Dr. Rogan, you were talking about preventative measures that each individual can take, and are you saying that you feel right now, even so far ahead in the new millennium and decade or whatever they keep reiterating to us, that tobacco use is still increasing and it's still one of the major causes of death? I know it's a contributor to certain types of cancers and chronic disease and inflammation.
Right. The reason why tobacco is just, it leads to so many different problems. Heart disease, vascular disease, definitely lung disease. And then also, in most tobaccos, there's so many carcinogens in the tobacco, it leads to certain types of cancers. They kick off the precursors to certain cancers and open up the gate for certain cancers to form. So even secondhand smoke is very problematic. People going to hookah bars, getting unfiltered smoke. People doing cigars, unfiltered smoke. Some cigarettes, most cigarettes do have some filters, but they don't filter out everything. So tobacco, highly number one leading cause, because it leads to so many other different problems. On top of that, you have inactivity, poor nutrition, microbial problems. Then on top of that, then alcohol consumption, it leads to other problems too. So if you smoke and you drink, that's a double whammy. And then if you eat a lot of food you're not supposed to and you have inactivity, that's all that together. So a lot of it has to do with what we consume that causes us to have the problems.
But Dr. Rogan, how realistic is that seniors in age 75, 85, if they smoke all their life, they're going to quit?
They usually don't quit, but statistics have shown that if over the age of 65, if you stop smoking, you can add about 5 to 10 years on your life for a female. For a male, of course, they always live less. It's pretty much between 5 to 7 years. You're going to add life. If you stop it, you're going to add life. You're going to add life anywhere you go. Period.
Do you
But-
have any program to help them to stop smoking?
Talk to your primary care doctor. Go into smoking cessation programs. Certain pharmaceutical companies have different medications out there for it. It's hard. It's an addiction. It's very hard to knock that addiction because it makes people feel certain ways. You have to really treat the symptoms after patients start trying to come off of tobacco, like the depression, the irritability, the anxiety, desire to want to put something in their mouth. You got these electronic cigarettes out there now that people are using. I have no idea what the ramifications are going to be about me sucking in some electricity for the rest of my life. I know if I live under power lines, I know that's not good, but I'm not going to.
Oh my goodness, you're right.
I'm not going to suck no electricity in my mouth for.
Well, what do they have? Do they have a nicotine in them in this electronic
think so.
cigarette?
It's some sort of vapor, but
It's vaporizers and stuff like that, but I'm not sure exactly what's in it, but it doesn't sound like it should be because they call them electronic cigarettes, and they give you this little hissing sound like when you puff on a cigarette, like something's burning or something like that, and you really think you're really getting something. It's mental.
Yeah, but
It's all
how do you
mental.
get out of the habit? Because you said half is nicotine addiction, another half is a habit. I mean, does they wean them off?
I would probably send you to a therapy center to try to get off of that. Talk to a psychiatrist, go through therapy, talk to a very close primary care physician, psychologist. Sometimes some people do acupuncture, some people do reflexology, some people do a lot of different things, behavioral modification to try to do it. There's so many things you try to have to do for that. But I know patients right now who are at home on oxygen right now who still can't stop smoking.
Yes,
just
we
can't.
have some patients like that,
Right,
that
we
with
do.
oxygen tank,
Right.
and they go, smoke with them, and that's dangerous.
And exactly. And I've been in a situation where someone has actually blown up a room where somebody was smoking
God
with oxygen.
goodness. I know, and one of our co-workers at the company did a hypnosis, and then so far it's been 8 months, and she hasn't smoked any cigarette yet.
Yeah.
Does it work?
It will, but hypnosis you just got to keep thinking about what hypnotized you. That's what's going to keep you from smoking. That's the only problem. I'm not going to walk around in a trance all day thinking about. I don't want no cigarette. I don't want no. It's like no, that's not going to be the case. I got work to do.
And you said acupuncture works?
Not in all cases. People use it. You will see some acupuncturists who say this will work, help you do that, and then some ancient Chinese medicine may say it worked, but everything will work. We already know that when you take this medication that some pharmaceutical companies put out, there's only 30% of the people succeed.
so
that's
it's
not
different.
good
It's different.
for different people.
For, yeah,
it all depends
different
on what you want. It's just like losing weight. If you want to lose weight, you will lose weight.
Yeah.
If you want to exercise, you can exercise. If you really want to stop eating pork and clogging up your arteries, well, some pork is good, but still, you can stop doing it.
Is
It all depends.
Dr. Rogan, all these therapy you're talking about, can they go to seniors' home and then work with them at their home? Do you think their insurances and Medicare will cover that?
Stop Smoking Cessation program will start right with the primary care physician. I may educate you, maybe recommend nicotine or Nicorette gum, may even offer pharmaceutical medication from a pharmaceutical company. But we'll see how those things work. But most seniors that I go who they're in facilities, I don't see too many of them smoking. It's usually the seniors who are still going down to the casinos. Seniors who are still running down to Hilton Head and on the weekends and stuff, and also down to Mississippi to try to, to the casinos. Those are the people that are still smoking, and those are the ones who are still need some help as well.
Well, losing some money, definitely. It's
Oh, yeah.
easier if you have a glass of wine and a cigarette,
Right,
you don't
right.
feel it as much.
Right, exactly. So,
Well, what other thing, beside the normal, like blood pressure and then high cholesterol that did you see is more common in seniors?
orthopedic problems, knee problems,
Yes.
joint problems, back problems. We see advancing signs of dementia in some patients. And dementia starts usually, the board question usually be who is the first person to actually notify you that there's been a change in their mother and father. Is usually going to be the daughter or the children, because they'll start saying, Mom or Daddy's just not thinking right. They're being forgetful. They're not hearing well. those are usually the first signs of some form of dementia. And usually those things, along with orthopedic problems, back problems, addiction problems, we even have a high problem with patients also having problems with pain pills too as they get older as well.
Is that bring addiction?
That's an addiction too. But those are usually easier to monitor because I can control that a lot easier than if you were going to a pain management clinic.
Well, one of the biggest problem right now in the home care patient is that a lot of pain medication is being disappeared, overused, just missing, I know we had some experience with that. Tell me about Exelon patches, is that what it is?
Yes, ma'am.
I have heard a lot of family, they're asking about that. Can you tell me about exactly what Exelon patches does? It's not for dementia, is it?
Yes, ma'am, it is. Exelon patches for dementia. And it's usually one of those patches that we wait and use after we've had a patient who's had the mild form of dementia. There's other medications we use. There's different tiers that we go through before we actually get to an Exelon patch. Exelon may be used for a slightly moderate type of dementia versus there may be a different medication that we may use for mild dementia. And then there's other medications for the moderate to severe dementia that we use, but it's used for dementia, period.
Dr. Rogan, I know I'm going to go back to smoking again because I know a lot of patients that they have oxygen, they are on oxygen, they smoke. If so, why the physicians are not prescribing those, nicotine, medicine that you were talking about?
Well, it's not like a lot of these patients that are still smoking who are still on oxygen are smoking a pack a day. They may be having like 1 or 2 or 3 cigarettes a day. They're trying to. It's not like someone who's 45 and smoking 2 to 3 packs a day of cigarettes. Those things that becomes very hard. One of the things that you have to do is you have to eventually wean that patient down off those medications. That patient who's on that oxygen is going to eventually wean down to very few cigarettes. But the medications that you do prescribe for some of these type of addictions, especially one particular one that I'm thinking of from a pharmaceutical company, the side effect profile associated with them are usually more worse than the benefit of the actual patient taking the medication, even though you may get a 30% success rate with the patient getting the medication.
And Dr. Rogan, another question has come up at past, and I want to clarify that some families, they are very hesitant to call home services that include physicians, social services, and they are afraid that if they see their home is not cleaned or they are not, and they smell not like they didn't bathe, they're going to call the DFAC and have them removed from their residence. Have you encountered anything like that? What is the circumstance that you ever or will ever call DFAC?
I've been in this situation before. I've been in homes where I've had to come out and maybe have to shake my clothes or had a little bite somewhere that I'm not sure where it came from. But I'm there for the patient. And if it's also a point where I need to bring in a different authority or different agency for the benefit of that patient, and if I think that patient's at harm, I will bring in that agency. But I will involve a social services department in order to make sure I'm making the right choices, and I also allow social services to go in there first before I actually call an agency to come in and take a look at what's going on in that home.
But then to ensure the seniors that then you're not there as a government agents to check them out to how they live, that's not what you do you?
No, I'm an advocate for the patient. Once I go in there and I start talking to that patient has a contract with me. I have a contract with them. I am their primary care physician. Anything they say and do is totally confidential. There's HIPAA laws, and I must provide by those laws.
Because I know it has been a concern at past. No, we don't want anybody to come in our house.
Right.
And maybe they had too many cats, or maybe they have dogs, and
right.
then that has been that's very reassuring to our seniors then.
Yeah, but there is situations where you think that the patient may be at harm, or that they have a very poor living environment, that this is not conducive for proper medical living or proper medical care, and I will have to mention it to someone. But I will talk to the family and say, look, can we get this done first? I will always give the family an opportunity to act first before bringing in an agency.
But that is extreme,
exactly.
circumstances,
right.
isn't it?
Right. And I haven't had many, but there's been a few that we've had to call in an outside agency.
Kelly, do you have any question?
No, I just think Dr. Rogan did a great job explaining the different types of the fluctuating. I don't know. It's just interesting to see the different type of options that are out there, and how I know as a younger medical student, we all have that cookie cutter mold stuck in our head, thinking I'm going to go do this, 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 this. And you're saying, there's different options, and just to kind of be aware of the different trends in medicine and how it does all come back to the physician.
Medicine has changed. It's a business. You have to run a business. And I don't like to run a business. I want to practice medicine, but doctors have now been thrust into the forelight of just trying to they have to be business. And most physicians are poor business people. Don't say nothing, Miss Malley. And so...
yes, physicians are very poor businessmen.
Yes, I can agree with that.
Very poor in doing that. And basically, we want to see patients. But then again, that's the whole idea when you have an office staff. You have to put people in place. I'm in agencies that I work with now that we have people in place. People have to play their positions, from the chief operating officer all the way down to the certified nursing assistant, all the way down to the person who's seeing the patients on every Tuesday at IDT. Everybody plays their position, and we have to have that.
But Dr. Rogan, I have to add to your statement, just as an adult child myself, that I have aging parents, just to make a phone call at night to you, and tell him, like, my dad is not taking his medication, or my mom is breathing hard. And you just, answering me, it really calms my anxiety down. Whether you come out and whether you don't, it's just talking and somebody reassuring me as a medical field. I know for a fact I cannot call doctor's office unless extreme medical urgency as an on-call doctor, and maybe I get a doctor who's not even familiar with my, the parents. And then this just been, like I said, adult child, it has been very, very, comforting for me. I mean, this is a great service. I hope more doctors, they can do this. Do you know any other doctors in different areas they do this? Is this very common they practice medicine?
It is growing. It's actually growing, especially in the state of Florida, where there's the high geriatric population. And, Georgia right now is running neck and neck with Florida, with the number of population for elderly patients, because they're leaving Florida because of the hurricanes, and they're losing all their homes and stuff. So they're moving here to Atlanta, and they're building senior high rises all over the city of Atlanta, places for people to come and move. And the weather is still actually a little crazy, even though we had a little problem a couple of weeks ago from the salt and stuff like that. But there are other physicians here doing it. There are other physicians, and they're colleagues of mine, and they're doing an excellent job and providing a great service.
Well, I know for a fact in one of the high rises, everybody's looking forward for you to go there.
Oh, yeah. I would love to.
And they say, today is Dr. Rogan is going to be there.
Yeah, they start to smile, and they put their good little hats on, their lipsticks. They're waiting for him.
I love my girlfriends and the 80-year-olds and the 90-year-olds.
Well, they love you. You make their day. And I think that actually Miss Malley brought up a good point. It's how much it affects them, just like visiting them, knowing somebody's coming, Dr. Rogan's going to come see me, or his assistant, or someone's going to come. It helps their overall mental health as well.
It's just like a personal, guest.
Exactly, it's a guest. It's a
brother, and then, of course, Dr. Rogan, you're not that old.
But you know what? One of the most enjoyable things in doing, you have to do a home visit to really see how satisfying it is to you. But one of the wonderful things is about, like, if the lady's sitting there on the phone and I go in and she's like, hold on, my doctor's here. Yes, Sarah. Yeah, my doctor comes to visit me. They start, old folks will start jockeying back and forth.
They're showing off.
They're showing off, exactly.
Yeah, they're showing off.
So that's very, pleasing and satisfying to me. It's very satisfying to do a home visit on a patient.
Well, I know my mother says you have some food for Dr. Rogan when he comes in. We always feed him.
I love that Persian soup.
Oh, who doesn't?
Who doesn't? Yeah, really. That Persian soup is awesome.
Well, they're looking forward to see you, and I thank you very much to, taking care of them for me is really comforting. And then I think we are about the end to our show. Thank you for coming. This show has brought to you by Homestead Hope Foundation, is sponsored by Homestead Hospice, which a group of passionate people they thought is a needed services for our seniors and adult children, me including one of them, need more educations and then guidance. Where do we go? How do we go, about finding, resources for us? Please do visit our website, and there's a bunch of information is there. It's homesteadhopefoundation.org. And then if you have any questions, do you want to call in, Our social workers are ready to assist you, and then you can call in 678-966-0077. Thank you for tuning in. Stay safe and stay happy. Find out what other services that around you that can make you live more comfortable and happy. Thank you.
I'm Jeannie Pete. Thanks for listening. Have a blessed day and week ahead, and listen here same time next week and every week. Homestead Hope Foundation is your resource for a healthy life. God bless.